Hello, Facebook. I am Dr. Mila Bennett of Adara Plastic Surgery and Medical Spa and creator of Pretty RX skincare line. And tonight I'm coming on to talk about liposuction. We haven't had a good liposuction talk in a while. Hi, Stephanie. Hi, Latoya. Welcome. Hi, Kanisha. So for those of you who are on with me now, go ahead and share the video and let people know that I'm on. You know what? I want to share the video too. Hold on. Let's see if I can. I didn't have my computer in here. I wasn't thinking. Let's see. Hi, Mia. Hi, Sierra, Liz, Cherie, Janet, Ulrika, is that how you say that? Tanya, Kathy. Oh, sweet. Hi, Shelly. Angela. Okay, let me try to share this. Let's see if I can share it. Cool. And then share it to the Darabella page. All right, good. We're in action. This is my light. So, all right, let's see. I'm great, Alia. Is that Alia? Alilia? Did I pronounce that correctly? Yes. So, hi, Fernande from Miami. All right, so some of you were on my video a little while ago. I just did one with my son, Bennett. Happy Tuesday, Hannah. My son, Bennett, he did a video, bedtime stories with Bennett, and he started reading in this action Bible that he got at school today. He read it from the library at school. He was so excited about it when he got in the car. And he wants to read, so I'm going to, and actually Bradley, the next time Bradley's going to read too. He said he wanted to read. So if you guys have kiddos, I'm going to do it a little bit earlier so that way people who are on Eastern Standard Time, their kids can watch the video. Watch the live stream. He can read. And then if people want to hear certain stories, can let them know. I'm going to let them do it from my page for a little while, and then I'm probably going to set them up a page together where they can read and share some of the stuff that they like to do, because they really like they like Facebook. They're always like, "Mommy, can we go live?" And I'm like, "No." So I went ahead and let them do it today, and it seemed like people kind of enjoyed that. So, and it's good for them because it makes them read. And I'm like, well, if you want to read, you can go live. So it's kind of serving everybody. So anyway, tonight we're talking about liposuction. So I just saw somebody say it's been a month and I think I've lost my result already from depression. What do you mean from depression? Are you depressed because you lost your result, or you were depressed so you were eating a bunch and lost your result? Because eating can definitely make you lose your result. So I did a consult with somebody last week, and she was talking about how her friend had gotten liposuction somewhere, and then, she lost her result. And I hear people say that all the time. Usually there's one of two main things happening. One, you gain a bunch of weight. That happens a lot. Sometimes, like, if people are thinking about liposuction in the wrong way, like, oh, I gained some weight, let me just get some lipo, or if I gain some weight, I'll just get lipo again. That's not good. So you'll have people who will be getting round 2, round 3, round 4, liposuction, because they don't change anything about their lifestyle, and they're just overweight, and they're trying to use liposuction as a weight loss strategy. So if you gain a lot of weight, I'm not saying 5 pounds, or if you gain 5 pounds or 10 pounds, as long as you're not like 4'4", if you gain 5 pounds or 10 pounds in your normal height, that won't really make you lose your result. But if you go and gain 20 or 30 pounds, then, that's something else. So you definitely want to, if your weight's not stable when you get liposuction, meaning you're gaining weight at the time that before you get your liposuction, then you get liposuction and you keep doing what you were doing, you're going to lose your result. But in the setting of a person with a stable weight, they have trouble areas, they're not obese, and they get liposuction. When people tend to lose their result in that setting, the problem is that they didn't wear compression post-operatively, or they didn't wear the compression long enough post-operatively. That is the main reason people lose their result outside of eating a whole bunch of food and gaining a whole bunch of weight. So what happens is when you get liposuction, I hear a lot of people will come to me and tell me that they lost their result from someone else. They had lipo. I'm like, did you wear a garment? Yes. How long did you wear the garment? 6 weeks. If you wear a garment for only 6 weeks, you're screwed. I don't know who told people to tell folks 6 weeks. I have not had one patient that got liposuction that was not still very swollen at 6 weeks. Even though you look really good compared to what you looked like before surgery, there's still a lot of active swelling. So what happens if you come out of the garment at 6 weeks, what happens is now you don't have the compression garment keeping your skin from expanding with the swelling, right? So you'll slowly keep expanding, and it happens kind of slowly. Once you get to 6 weeks, the expansion happens a lot slower. So you'll slowly be expanding because you no longer have the garment holding you in. And while you're doing that, you're still healing. You're still making collagen to drop into the area, like drop scar into the area. So what happens is where the fat used to live, the fat used to be in here. What happens is instead of fat being there, since we liposuctioned it out, your body replaces the fat with scar. So if you're expanded out like this, you'll just drop scar into all this. If you have a compression garment on and you have stuff like this, you can only drop scar into this. So basically your body is going to fill the space back up with something, and it's not likely to be fat unless you're eating a whole bunch of food. And when it's in the event that it's scar, that's so bad because you can't liposuction scar. So when the people come back trying to get lipo again, often what will happen is a lot of blood they'll lose a lot more blood, less fat comes out. The result is not going to be as good as it was the first time unless somebody is extremely aggressive. But here's the thing, if you're bloody and then you're getting a bunch of aggressive liposuction, what happens next is necrosis or really, really bad fibrosis. So I don't care what people say, you need to wear your compression garment for at least 3 months. And I have people who come in at the 3-month mark, and if it's still visible swelling, I'm like, sorry, boo, you got to stay in your garment. Let's see each other again next month, and we can re-talk about it. So when, I just lost my thought just that fast. So I tell people, my patients, after you get liposuction, your body is like wet clay. What does that mean? So right after liposuction, you are very malleable and moldable, which is why the garments are so important. Again, because your skin has the memory of what it was like before the fat came out. If you're not wearing a compression garment, it's gonna hold on to that memory. So the compression garment, when your body is like wet clay, which is, how you are when you have this active inflammation from fresh liposuction, the compression garment can change your shape and it shrinks you. So clay, when it's wet, you can mold it and shape it very easily. As it dries, which is when you get to about the 6, 8, 9 week mark, your clay starts drying. It's not completely dry, so we can still affect the outcome at that point, but it's harder to affect the outcome as compared to when you first get the liposuction. For any of you who've had liposuction, if you think about like the first few days or week after surgery and you take your garment off to get in the shower, and when you first take it off, you look at yourself and like, oh my God, it looks so good. And then by the time you get out the shower, you're like swollen up like crazy that fast. That is your super your skin and your form is super responsive to the compression at that point. And so this is the time when we can make your skin do what we want it to do. We can make your shape, accentuate your shape even better and all that kind of stuff. On the flip side, because you're wet clay at that beginning part, you want to make sure your garment's not doing things that is hindering where we're trying to go. For example, for people who have like bra rolls and creases, like, you know, on their sides, you don't want your compression garment to be accentuating the creases. So if you have on your garment and it's falling right into the fold, guess what? You can't expect to heal without the crease if your garment is accentuating the crease. So that's where you want to put foam in and stuff like that to keep the garment from reinforcing the crease that we're trying to get rid of. And so the foam will help things to be flat. So the foam helps us make our wet clay be smooth instead of having our wet clay have a crease in it. So all these things are really important to what your outcome is. I wore my compression garments for almost 6 months, and even after that I had to wear it off and on because I experienced swelling off and on for a year. Exactly. So I tell my patients at least 3 months, 24/7. And if they get, so like people who are getting liposuction now, like this right now, I'm like, look, wear the garment till next summer. Just stay in it. Because once it's cool outside, it's not as big of a deal. It's really hard to get people to be compliant with the garment in the summertime, which is why I tell people, look, if you're not going to wear this garment, do not get this liposuction, because this is going to make both of us mad. It's a waste of your money if you're not going to wear it. Then I have people, they're like, I'm wearing a garment regardless of if I get lipo or not, so I can still get my lipo in the summer. Okay, that's cool. But people who aren't accustomed to wearing it, you know, you might not want to get your liposuction in the summertime. So is it safe to say as soon as you take it off, your body can still swell? Yes. Is it best to have harder foam or any foam to make sure you don't crease while in 5? We give people soft foam. I'm yawning, but I'm actually not even sleeping. We give people soft foam. We tend to give people soft foam for this kind of stuff. And then the abdominal board is in the front. We have that in the front. Sometimes people will get like the abdominal board. Get like a harder board in the back. Like if I do gluteal contouring and we're trying to create that little triangle above the glutes and the lower back, sometimes we'll use firm things for that. But is really no right or wrong answer. After liposuction, I seem hungrier than ever all the time. Is that a side effect or am I tripping? You could be hungrier than usual because you're healing a lot of surface area. And so that takes protein, that takes vitamins. So your body's going to be using a lot more energy than normal. So yes, you can definitely feel hungrier. But the good thing about the garment, if you're in the right garment, you won't be able to overeat because you won't have space to. I had a lipo burn and couldn't wear my stage 2 until 5 weeks for surgeon orders. It's too late for my stage 2 to help. Yeah, if you had, okay, that's a whole nother lipo burn. I've never had a patient get lipo burns. That's a whole nother video topic. Put your garment on when it's safe, when your surgeon tells you it's safe to do it. Do you believe your butt gets bigger at 6 months? You mean the fluff theory? I think there's some truth to that. Yes. For fibrosis, you can get massages, lymphatic massages. I had to take mine off. It was uncomfortable. It was 110 degrees in Texas. I got itchy just going to the store with a full garment on. Yeah, you're gonna tear up your result. Like, and it's it's gonna be messed up forever. I would probably rather just be itching. Oh wow, Rosalind, you need to talk to your doctor about that. Do you have to watch what you eat after lipo? You need to, yes. So you don't want to be eating a lot of salt. You don't want to do a lot of drinking of alcohol. Those things increase the swelling. Talk to your doctor about how long they want you to wear your garments. I don't like people to ask me specific questions when they've had surgery with somebody else. You need to ask your doctor that, because I don't know what you have going on. Just like with the girl with the lipo burns, like, you have to do what your doctor says. I'm not your doctor, so I'm speaking in generalities. There's always exceptions to the rule. Of course, your health and, if you're having complications, that takes precedence over, garments or types of garments or duration and all that kind of stuff. So if you've had surgery, this video is not where you should be going for advice on what to do next. You need to be talking to your surgeon. And for those of you who are on here and joined like in the middle of the video, please share the video and let people know that we're on. Swelling when having a couple drinks, more water beforehand. Yes, water always helps. So if you drink or you have a really salty load, drink a lot of water before and after. How can you tell if it's swelling or fat after lipo? You know what? You kind of can't. Wait a minute. Swelling or fat? What do you mean? I'm confused. You mean right after liposuction? It just, I don't know. You can look at it. Like, you can tell by the way the skin feels. It's kind of boggy. And for you, what you can do is see if you look better in the morning as compared to how you look in the evening. If it's changing, then that's swelling. If it's consistent, then it's not. Like some people, you might look better some days than others. That the things that play into that is salt, exercise. Exercise is good for you, but it actually still causes a little bit more swelling. So, if you had a more active day and you find that you're looking not as good as you looked before, that's swelling. All those things, temperamental things, are usually swelling. Fat is always there. That's the main way, Autumn, is not compressing after surgery. And the other way is eating, gaining a lot of weight. That's the way to lose your result. Those are the two ways. How long after gastric sleeve surgery can you have lipo BBL breasts? You want to wait till your weight has been stable. Your weight needs to stabilize. And then you can proceed with cosmetic treatments. Some women wear a corset or at the workout thing. Can that hinder your lipo results over wearing a fob? No, as long as you have enough compression, it shouldn't hinder your results. Recovery time after lipo in my hands is about 3 days. 2 to 3 days. How do you wean from compression? I get very sore when I don't wear it 3 years post-op. That's not normal. I guess you would have to just kind of stop wearing it and just let your body get used to not having it on. But my patients don't usually wean from compression. I mean, once they hit the mark, a lot of them just come out of it. And some people just keep wearing it because they just like it. After my BBLs, I let the people start to do small increments of sitting after 3 weeks, very short increments. They can't just sit freely until 6 weeks. What type of paperwork should I ask my doctor to get to approve for surgery by you? If you book a consult and then book surgery with me, my staff will go over whatever stuff. Every person doesn't need the same paperwork. It depends on what you have going on. No, I don't do J plasma. I tried it out. I wasn't impressed, so I didn't buy it. I'm just going back looking at questions, y'all. I think I've been catching them all. Okay, let me go back to the bottom. Do you think a faja is necessary? Yes. Absolutely. Imperative. If you're not going to wear it, don't get lipo. But if you go to one of those jokers that do aggressive lipo, do whatever they tell you. If they say don't put this garment, don't put a garment on, then listen to them. Because if they have liposuction to every bit of fat out of you and killed all the blood supply to your skin, and your skin is hanging on by a thread, and then you go and compress it down with a tight compression garment, then you'll kill your skin. And then they'll call it a lipo burn, or they'll call it a faja burn, when really what it was overdone liposuction and compromised blood supply. That's what that means. That's what that is. It's not a burn from lipo. Unless you have some sort of laser or heat, some sort of energy assisted liposuction like the laser or Vaser or something like that. You can burn the skin with those devices, but just straight lipo, that's called overdoing it. Oh, thanks, Autumn. She said your skin is so perfect. Thanks. So of course I use my Pretty RX products, and I also get treatments in my office. So last week I got a vampire facial. So I'm still I'm still in evolution from that. I'm probably gonna get Chanel to give me a hydrofacial tomorrow. You can see up close. Hold on, I'm gonna take this off the stand for a second. Up close, you can still see like it's a little grainy. You can see you see those little dots? That's from the microneedling pen. So I get like the really deep needles. So my skin is in evolution from my vampire. Usually I keep getting improvement for about 6 weeks after the vampire, and then it's time to get another one. So I just got it last week, so I'm definitely my skin is still in evolution from that. What's the difference between Lipo 360 and a tummy tuck? They're nothing alike. Lipo 360 is liposuction of your back, sides, and abdomen. A tummy tuck is excision of excess skin and fat from your belly button down and plication of the muscles, meaning sewing the muscles back together when you have a diastasis, and then repositioning the belly button. That tummy tuck is not anywhere near the same as liposuction. Do you give those facials at your facility? Yes. Hydrofacials are, I have videos on my Darabella page about hydrofacials. You can go check that out on that page. Or on the Pretty RX page, we have some hydrofacial videos also. Can the next video be about doing, please? About doing what? Oh. Have you ever done a video about doing lipo with the cannula instrument and safest way? All liposuction is done with a cannula. Like, you can't do liposuction without a cannula. And I like power assisted liposuction. That's my preferred method. But all liposuction requires a cannula. If you take a job that you drive for a living and you take 2 weeks off work, will sitting on your BBL pillow long periods of time affect your results? Sitting on the BBL pillow is probably okay, but if you're like a truck driver, that amount of sitting, I don't know. If you're not sitting on on the area that have fat transfer, then it should be okay. But it seems like sitting long periods of time like that on your thighs, that could increase your risk for other issues. Talk to your doctor about that. Thanks, Lavita. Okay, let's see. I DM'd you about the casting and Lipo girls. Yeah, I forwarded the information to the producers and they picked the people that they wanted. We shot that show already. And it's gonna air this month or next month. They said they would let me know a week ahead of time, and I'll let everybody know when it goes. But everybody who DM'd me about that the show, I forwarded straight to the producers. It wasn't my choice, it was their choice. So they did what they wanted to do with that. Why do some doctors require compression and others do not? That's a super great question. So some of the doctors don't require compression because they have no idea what they're talking about. Because some of the doctors, most of the ones that I know that tell you not to wear compression aren't even real plastic surgeons. So they're just like, they don't know. So that's one big reason. The other reason is the people who tell you not to wear compression are oftentimes, if they are a plastic surgeon, they're one of the ones that do aggressive lipo. And if they've done an extreme amount of liposuction in that area and killed all the blood vessels going to that skin, and then you go and put a tight compression garment on top of it, it's like the little bit of blood supply that's getting up to that skin, when you put that compression garment on it, it chokes it off, and then now the skin has no blood supply, and then your skin dies. It's just like, think about it like this. If a person has asthma and they're actively having an asthma attack, so they're struggling to get air in, and then you go and take your hands around their neck and choke them, that's going to finish them off. That's kind of what's happening there. So, like, that's a huge red flag if you have a doctor who's telling you don't. If they're telling you beforehand, no, I don't have my patients wear a compression garment after liposuction, I personally would run. I don't care who you are. You can't change physiology. And when human tissues have trauma, which surgery is trauma, they have to swell. Swelling is required to heal the area. And if you don't control the swelling in the setting of liposuction, you absolutely 100% will compromise your outcome. You can't get to your maximum outcome without compression after liposuction. It's impossible. I don't care who you are and how good you are or how popular you are. You can't change like the laws of physics, and you can't change the laws of anatomy and physiology. You just can't do it. So people have different reasons. If you've already had surgery, do what your doctor told you to do, because like I said, I don't know what's going on with you, and I don't know what that doctor did. So if you've already had surgery with somebody who told you don't wear a garment, then listen to them. If you have not, and they're telling you, no, I don't have my patients wear garments, I personally would pick somebody else. Thank you, Michelle. I mean, y'all just full of all the compliments today. How many lipo cases do you do in one day? I won't do more than 2 people a day. Yeah, I'm not doing 4, unless it's okay. I'll do 3 cases if one of them is very, very small. So like last week I had I did a little earlobe repair. That surgery was only like 45 minutes. And then I did 2 lipos after that. Like, that's the only way it'll be 3. I won't do 3 big lipo cases in one day, because I'm not gonna be. I won't be good to the third person the way I was to the first and the second one if I'm too tired, or it just won't be as good. So, and I'm not like I just have no desire to do that. Yes, it's safe to wear a file without having any surgeries. A lot of people do that. Lipo procedure, it depends on how many areas you're getting and the size of the person beforehand. Like, if obviously a thick person is gonna take longer than a thin person that just has a pooch somewhere. Like, it totally different. It totally varies. The best types of food to eat after a tummy tuck: low sodium, high protein. Make sure you're getting adequate vitamins, that type of thing. Yes, it's normal to be itchy in the areas of treatment. After lipo, how long you recommend being off work? 2 or 3 days. Lipo is like you'll be sore, but it's like workout sore. So you can go on about your business after a couple days. Is it possible for your MRI to hurt or feel discomfort if you gain weight after tummy tuck? I haven't really heard that before. And your skin, when you gain weight, is gradual, and the tissues stretch gradually. It shouldn't just start hurting just because you gain some weight. I feel I need around 2 for lipo. I had a mommy makeover done in Miami. There was still fat pouches left. I was also under the BMI. Do you use C-entry implants? Sometimes. My scar is killer. Do you do scar removals? Yes. For your out-of-town patients, how long do you require for them to stay after a lipo procedure? It kind of depends on how far away they're traveling and how they're traveling. So worst case scenario, 5 days. If it's just straight lipo. If somebody's close, like a couple of hours away, 3 days. Like a couple of hours away by car. If you're getting on a plane, it's 5 days. All right, y'all. I guess I'm gonna go ahead on and sign off. So, not last week, but the end of the week before, I think it was, or maybe it was the beginning of last week. I alluded to the fact that I was going to have a liposuction special, and then I never got to talk about it because when I planned to do it, it was like all this drama. Last week was drama. So we had an email go out, but I didn't get to announce it. So only a few people got to take advantage of it. So I'm going to extend it again because I never got to announce it. So if you are interested in liposuction, like now or like soon, then go ahead and reach out to my office so that you can find out what the special is. And this is the last one until next year, for sure. My consult fee is $150. When we're having the special, which we are for this week only, it's $75. So if you want to have a less expensive consult, this is the week to do it. So my website is www.ederabella.com. Or you can call the office at 678-325-0006. This is actually the first time that I had a special during peak season. Normally I only do it in the summertime when stuff is a little bit slower. Local or general is not, I can't answer that question. Some people can't get it. They're not a candidate for being awake for the liposuction. So it's person dependent. Those are both viable options in my hands, but it depends on the patient whether or not I am willing to do it with them awake. So this is the first time I've ever had a special during the season where people actually like to get surgery. So you better take advantage, and this is the last one until next summer. My phone number is 678-325-0006. My website is www.ederabella.com. And for those of you who want skin like mine, you can go to my website for PrettyRx, www.myprettyrx.com. If you're not sure what to get, you can always try our Pretty and Polish kit. And if you want to do what I do, then you would get the Forever Young kit with skin texture. And you would get skin purifying mask. And you would have correction pad. You would have a lot of stuff if you want to do what I do. But out-of-town patients, I do consultations virtually. But then you have to come in I have to meet you before surgery though. No, I don't have a recommended recovery houses. I don't encourage recovery houses. My patients don't stay in those places. I don't like them. So if you are coming from out of town, we'll send you all the information of where we like to have people stay, and if you want a nurse and all that kind of stuff, we can help you with that. But I don't recommend the recovery houses. I don't like the ones that I've experienced in Atlanta. I don't like them, and I don't send my patients there. Sweet. Well, Kanisha, if you know you want lipo, you might want to make sure you don't miss this one. I don't know if you want to call tomorrow. I'm not sure what happened today, but what is that you for your face again? What do I use on my face again? I use my products, Pretty RX, and then I get treatments in my office. I get hydrofacials all the time. I get vampire facials. I get radio frequency treatments. I'll be getting a chemical peel in October. October is when our chemical peel season starts back up. Yes, I do mommy makeovers. I do plastic surgery from head to toe. Yeah, so what does the skin texture do for your skin? It is a retinol. It does everything. It's like, it's something that I recommend for everybody, but I didn't put it in the kits because it's like really powerful, and so I just felt like that should be sold separately. But it helps induce collagen growth. It shrinks pores. It helps stabilize your pigment producing cells. It helps fight acne. It helps your skin auto exfoliate. It just does. It's a workhorse. Anybody that comes into my office and I create a regimen for them, they get skin texture. Everybody gets skin texture. I don't give prices over Facebook because it depends on the person. So, yeah, I don't do prices. I don't give quotes that way. You have to get a consult to get a price. Every once in a while we have specials for skincare treatments. You just missed the hydrofacial special we had last week. We'll be having our peel party soon, so it's specials at the peel party. It's our annual Pills and Prosecco event that we have every fall when chemical peel season starts back up. Yep, Pills and Prosecco is coming back. We'll be doing that next month. I think we said it was going to be the first Saturday of October. So you'll be seeing something on our Adarabella page soon about that. If you're not following Adarabella, you should, because that's how you find out about things that are going on in the office and that type of thing. Yes, Kanisha, be proactive, girl, so you don't miss this special. If you know you're ready to get some surgery, you definitely don't want to miss it. How do I order correction pads? I just ordered the blemish-free kit. So correction pads, you have to get a consult for that one because it's hydroquinone. It's 4% hydroquinone is part of the ingredients, and so that's prescription. So you can do a consult with me or my medical esthetician. The ones with my medical esthetician are half price. So consultation with me is $150. Consultation with her is $75. And in the setting of skin, that the consultation fee does not come off the price of your products. So Chanel is my medical esthetician. She is outstanding. It's okay to get a consult with her if you know that you just want the correction pads. Like, you can save the $75. She is an extension of me. She is awesome. She is smart. She is capable. Yes, she's the bomb. That's why she worked at my office. No, I don't have chemical peels for purchase, Amari. Not as of yet. All right. No, you can't book facials on the website. You have to call the office. The Skin Bio Boost, I use that too. It's part of the Forever Young kit. It's one of my favorites. So I use my Skin Bio Boost in the morning, right before my sunscreen. Skin Bio Boost is full of peptides and antioxidants. It also has something that mimics like Botox, so it helps relax the muscles to reduce dynamic wrinkles. It helps neutralize free radicals that are created in your skin by the sun and stuff like that. I love my Bio Boost. I use it like a moisturizer. It's hydrating. It's a little thicker. It's not like a thin clear serum like some of the other things. Like Complexion is a thin clear serum. The Quench is thin clear serum. The Bio Boost and the Skin Bright, those are thicker. Oh, I save every live. So yes, you can go back and catch the replay. Chanel is the truth. I had some issues with dryness after using the Forever Young kit. Talked to her, and I was able to. Hold on. Stop the dryness. Very helpful. Yes. And your Forever Young kit should have come with Quench. It might have been your cleanser, depending on which one you chose. But yeah, you said Chanel got you together. She knows everything. She knows she knows everything. She's good. Hello, doctor from upstate New York. Hello. All right, y'all. I'm really gonna get off this time. So, no lip fillers, boo. This is me. This is all natural. I have no fillers. I have nothing. I have 0 injectables in my face. I don't get Botox. See, everything moves. I have no fillers. These are my natural lips. I use, when I microneedle my face, I needle my lips. So I just, on the Pretty RX page, my vampire facial that I got last week is on there, and you can see she needles my lips. That stuff keeps my lips plump. I've always had big lips. And I do, whenever I do collagen-inducing treatments on my face, I do it on my lips too, to keep them full. Because everyone's lips shrink as you get older. Every single human. Oh, yeah, I do lip fillers, yes, but I don't have them myself as of yet. I'm sure there'll come a day where I'll need to get them, but right now I don't have them myself. But I do lip fillers. I love doing filler in the lips. And my patients' lips look natural. So a stranger wouldn't look at you and know that you got your lips done if I do them. People who know you well may know, but strangers won't know. They'll just think you have pretty lips, extra pretty lips. Do I do multiple procedures at one time? Yes. Thank you, Aaron. All right, I'm getting off for real. That's like the 3rd time I said that, but this time I mean it. So, Dr. Mila Bennett of Adarabella Plastic Surgery and Medical Spa and Pretty RX by Dr. Mila. You can reach me at my office, www.adarabella.com, or call at 678-325-0006. If you're interested in skincare, you can go to www.myprettyrx.com. All right, everybody, thanks for jumping on with me. Share the video. Bye.